Hello everyone. Today we will be discussing about pemphigus. So what is pemphigus? It is actually a skin disease and also a vesiculobullous lesion which is autoimmune in origin, and its characteristic features are blistering which occurs in cycles, and it is a life-threatening disease. So let's move ahead. It is defined as a group of potentially life-threatening autoimmune mucocutaneous disease characterized by epithelial blistering in cycles affecting cutaneous or mucosal surface, and it was named by which man in 1971. So its types are, these are of 5 types. Pemphigus vulgaris, which is the most common type. Then comes Pemphigus Vulgaris. You can see the picture here. Then comes Pemphigus vegetans, and here comes the picture. Paraneoplastic pemphigus, which is the 4th type. And then we have 5th type, family benign pemphigus, also called Haley disease. So let's move to Pemphigus vulgaris. So it is the most common type, and the condition, the effects are almost similar to what is common about pemphigus. It is autoimmune intraepithelial blistering disease affecting skin and the mucous membrane mediated by circulating antibodies which are directed against keratinocyte cell surface. We will learn about this in upcoming pathogenesis. So there are 2 proteins named desmoglein 1 and 2. In step 1, what happens is these 2 proteins, they attach to the epithelial cells. Now these epithelial cells are joined together by what named desmosomes. And when they attack the desmosomes, the cells, the epithelial cells, they get separated, and thus the process called acantholysis. Desmoglein 1 is seen in superficial layer of epidermis, and 3 is seen in parabasal region of epidermis. And as a result, blisters are formed which then turn into ulcers. What are clinical features? They occur in age group of 40 to 60 years, and there is no gender predilection. Location or sites: labial mucosa, buccal mucosa, ventral surface of tongue, gingiva. Of course, there are other sites too, which we'll see later on. Signs and symptoms. The vesicle bullae, they appear very rapidly all of a sudden, as if a person is sleeping at night, and in morning you will see whole mouth full of blisters and ulcers. They range from few to few centimeter. They have ragged borders, and they may be covered with white or blood-tinged excurate. When they rupture, they leave a raw eroded surface. What is Nikolsky sign now? It is characteristic feature of Pemphigus vulgaris. What happens is, let's see the definition first. When pressure is applied to normal area, it results in formation of new vesicular lesions. Now what happens is, जहाँ पे वेसिकल्स और ब्लिस्टर हैं जो भी एरिया पे, उसके साथ का जो एडजेसेंट नॉर्मल एरिया होगा, जब हम उस पर प्रेशर अप्लाई करेंगे तो ब्लिस्टर्स और वेसिकल्स फ्रेशली फॉर्म होंगे. तो इसको कहते हैं निकोल्स्की साइन. इसका जो यूज़ है वो हम डायग्नोसिस में देखेंगे. It results from upper layer of skin pulling away from basal layer, and it is caused by perivascular edema. Now what happens is, dermal and epidermal junction is disrupted by applying pressure, and it is also a characteristic feature. You can see here pressure is being applied on the normal adjacent area, and vesicles and bullae are being freshly formed. Oral manifestations, they always precede skin lesions. Oral manifestations are seen before any skin lesion can be seen. Intact vesicles are rare, means they do not remain as it is in the mouth. They rupture as soon as they are formed, and they form erosions. They are painful, slow to eat. Patient feels difficulty in eating and drinking also. The erosions, they are scattered and extensive, and they may be seen on any part of the oral cavity. And if they involve larynx, they will cause hoarseness of the voice. Patient is unable to drink and eat. Other sites includes conjunctiva, esophagus, labia, vagina, cervix, penis, urethra. You can see the picture here. Again, now histopathological features. This is the diagram where we can see characteristic Zank cells, stratified squamous epithelium, acantholysis of cells after the attack of autoantibodies to the desmosomal junctions, and then we can see suprabasilar split, and beneath is the connective tissue. This is the microscopic view. So intraepithelial vesicle formation producing distinctive suprabasal split. And then actually what happens is entire superficial layer, it is removed, and what will remain there, only basal cells will be left, which will be attached to the basement membrane, and as a result the appearance is row of tombstone appearance. tombstones के जैसे वो दिखता है एक रो में, इसीलिए उसको रो ऑफ tombstone appearance कहते हैं. And then we have characteristic, there is perivascular edema, weakens the junction, that's fine. This is Zank cells. These are clumps of epithelial cells which are often found lying free within the vesicular spaces. Now ये cells होते हैं epithelial cells, जब इकट्ठे होके clumps में ऐसे ही पड़े रहते हैं तो उसको Zank cells बोलते हैं. ये round shape के होते हैं, hyperchromatic और enlarged होते हैं. It is characterized by degenerative changes, जिसमें swelling होगी, hyperchromatism दिखेगा हमें, hyperchromatic staining हो गई round shape nucleus की. Now comes the diagnosis. Diagnosis is Zank smear और Zank test. Now इसमें होता क्या है, जो हमने freshly prepare किए हैं blister, जैसे कि निकोल्स्की साइन में मैंने बताया था, तो उसमें से हम क्या कहते हैं, स्मीयर प्रिपेयर किया जाता है. बेस ऑफ ब्लिस्टर्स को हम स्क्रेप ऑफ कर देते हैं और हम प्रिपेयर करते हैं, स्मीयर प्रिपेयर करके उसको एग्जामिन करते हैं, तो हमें कैंथोलिसिस ऑफ सेल्स दिखती है. उसके बाद जो वेसिकल्स के अंदर फ्लूइड होगा जो 1-2 दिन पुराना होगा, उसमें हमें पॉलीमॉर्फोन्यूक्लियर ल्यूकोसाइट्स एंड लिम्फोसाइट्स दिखेंगे. और इम्यूनोफ्लोरेसेंस टेस्ट होता है इसमें एक, और इन्फ्लामेटरी सेल इन्फिल्ट्रेशन बहुत कम होती है. बाकी बुलस लीजन्स में ज़्यादा होती है, इसमें स्कैर्स होती है, इतनी नहीं दिखती है. इम्यूनोफ्लोरेसेंस में हमें फिश नेट, टिपिकल फिश नेट पैटर्न दिखता है, बिकॉज जो इंटरसेलुलर स्पेसेस होते हैं उसमें IgG, IgM and C3 will be seen. You can see the picture here, fishnet, typical fishnet pattern. Then next we have is compression air test. Application of stream of compressed air onto oral mucous membrane of gingival tissue. We will see shimmering of outer tissues, and then later on bleb or blister will be formed. This is chicken mess pattern by deposition of IgG. And then is treatment, corticosteroids, prednisolone 40 to 60 mg per day is the treatment of choice or drug of choice, you can say. In severe cases, we give 60 to 100 mg per day, but steroids should be tapered off to prevent withdrawal effects. And newer therapy include administration of 8-methoxysporolan followed by exposure of peripheral blood to UV radiation. Symptomatic treatment to be given, for example, analgesics to prevent pain, oral mouth washes to maintain oral hygiene. Thank you. Like, share and subscribe if you do like the video.